correctly, having most of this 80% fat coming from mono and polyunsaturated fatty acids, also known as omega-3s and omega-6s, can help reduce the cerebral edema these patients experience by reducing their inflammation. Despite this well-known theory being around for years now, the studies that have the most support for the ketogenic diet and cancer are mainly for brain tumors. Another recent study from Dr. Adrian Scheck shows how the ketogenic diet sensitizes malignant cells to be killed and saves normal cells during chemotherapy and radiation. Another scientist, Thomas Seyfried, PhD, has been studying the ketogenic diet and its effects on epilepsy and brain tumors for over decades. He's published over 20 articles on the subject, with the most recent case series published looking at a 38-year-old male with glioblastoma using the keto diet along with other metabolic therapies. His disease has been stable for 3 years now. The diet is also currently being investigated in endometrial cancer, breast cancer, prostate cancer, and other advanced cancers. That said, there is no evidence that supports using the ketogenic diet alone as a way to treat cancer. If the keto diet is used at all, it should be under the supervision of an oncologist and along with other science-backed cancer treatments. Is using the keto diet in cancer treatment safe? As promising as this sounds, there are several considerations to think of before starting this diet if you have a cancer diagnosis and are actively in treatment. For instance, if you have a diagnosis of non-small cell lung cancer, esophageal, pancreatic, or gastric cancer, or are undergoing a stem cell transplant, your metabolism tends to be more altered and you burn calories much faster than you would with other cancer diagnoses. Pancreatic cancer and cancers of the bile duct and gallbladder tend to cause fat malabsorption and therefore may not benefit from a ketogenic diet. It's also possible to have nutrition impact side effects that may be hard to manage on the diet, such as diarrhea and nausea. Poor appetite and intake are also common during cancer treatment, and people who do not eat regularly are prone to hypoglycemia, or are taking glucose-lowering medications such as metformin can experience low blood sugars. This effect is enhanced on the diet and can be very dangerous. So what is the take-home on the keto diet and cancer? It's not quite cut and dried, and there are a lot of factors to consider. It's important to ask the right questions. Do you have a cancer diagnosis that might benefit from the keto diet, or is there currently research being done testing the keto diet on your type of cancer? Have you recently lost or gained weight unintentionally? Are you having side effects from your treatment that has affected your eating? Are you in survivorship? There are many individual factors to consider. I encourage anyone with cancer or who had cancer and is thinking about utilizing the ketogenic diet as an adjunct to their treatment plan to speak with their MD and RD about it. This isn't a diet you should do without medical supervision. Want to know if you should go keto? Paleo? Whole 30? Deciding what to eat to feel your best shouldn't be complicated. We've removed the guesswork to give you all the best nutrition tips and tools, all in one place. Ready to kickstart your health journey? We're here to guide you.